focusing a little bit on your presentation this morning, and in that presentation, you explored the way publishers could assist authors and editors and reviewers in developing high-level research, high-quality research. And I was wondering, for the folks who couldn't make the presentation, if you could talk a little bit about that.
Sure, Tom. It's so nice to be here, and I really enjoyed the session this morning. It's I'm really passionate about this particular subject, particularly because I think it's getting more and more complex for authors and editors. I think just navigating, but authors in particular, navigating the landscape of the options that they have available, how they can get, they're competing with lots of other people to get into the best journals, to get their paper published, and then once it's published, it's no good if it's not read, and it needs to be read by their peers. So I think we have the interests of that customer group, your patrons, our authors, very much in mind. And I was exploring ways that we both bring to the table, training, tools, guidance, whatever it might be, to help authors navigate that complex landscape.
Were there any specific strategies you talked about?
I think, well, there's a couple of things. Certainly for non-US, non-English speaking authors, I think there's some really nice tools and services out there. We partner with one. I think most publishers partner with one of these services. And it gives them a chance to get their paper perhaps translated, checked, make sure that it's going to be at least read and considered by journals that they might want to get into. I think those are good services. Just the tools in the system, how you find reviewers, how you can actually plug in those things to make the editor's job easier, to make the reviewer's job easier. I think those kinds of tools are very valuable too.
Yeah, that's from the publisher side. Do you have any sense of, or what do you think librarians could do to assist in this area?
Well, when we were investigating how, some of these topics that we wanted to talk about today, we were looking at some of the really great library sites that there are out there, and I had one in the presentation this morning that really gives an author or library patron a place to go to find everything they might need to find in terms of putting their paper together, what resources there are out there, because there's some great services like COPE, for example. If you're publishing a clinical paper, there's some great ethical guidelines, that kind of thing. So this particular library site had a lot of links to these different services that are available to basically anybody who wants to really publish and get into really good quality research.
Yeah. In another area that you talked about this morning, I wanted to investigate a little further regarding archiving. You stated your personal opinion, questioning the responsibilities of various players in the archiving role, and you questioned whether publishers or even libraries should have the primary role in the archiving. I wonder if you'd expand on that a little bit and what your thoughts are about that, because it's a very serious problem that affects all of us, and especially the library's primary missions.
Absolutely, and I think it's an incredibly critical issue, and I think as far as the core journal or book content is concerned, I think we have nice processes in place, we have good partners in place that we work with, that the library community work with, people like Clocks and Portico, and we can work with them to make sure that core content is preserved. And in fact, when I was at a previous publishing company, I actually had a journal that stopped. It closed down, and we thought, well, let's release it through one of these archives just to test it, see if it works. So that was, it's nice to know they're there, and we are very strong supporters of them. I think what I was questioning was the data archiving, so the data behind an article, because that data can be in many different formats. It needs to be kept up to date. It will vary enormously what kinds of data need to be collected by different subject areas. And so I think there's a lot of discussion needs to go on about, is that the library role? Is it the publisher role? Is it the funder's role? I mean, whose role? Is it the author or the researcher's role? Is it the research lab's role? I think everybody knows that data should be collected and preserved so that we can test the reproducibility of research. But I think there's we have some way to go in terms of figuring out who should do that, and I'm not sure that publishers are best placed to do that. But I was interested in getting some feedback from the room, and it was fairly clear that there were more librarians in the room who had felt that that was an important role for them than there were publishers.
It may even be that libraries are aware of the problem and trying to address it, where it may be the institution. Because the library may not have the capabilities. It may be the IT departments.
That's true.
And
yes.
actually you talked about standards as really where probably we need to go.
Yeah, absolutely.
You want to talk a little more?
I think we've done a great job in working together on, first of all, developing standards and then making sure that we use them. I think the DOI is something that is just widely used. You wonder how we could publish without things like that now, without the DOI and Crossref and some of the great standards that organizations like NISO are helping to develop for us all. There are not the same data standards. Certainly not in the medical space that we work in. There are some small areas where they have got some nice repository and they have standards, but one of the things that I was saying is from discipline to discipline, the data might be, they might be images, they might be videos. If it's surgery, for example, it might be a video.
Right.
If it's another discipline, it might be CT scans or X-rays, or it could be pure data. It could be data about patient outcomes, or those kinds of things. So I think that's why I think it needs to be, standards need to be developed discipline by discipline.
There's sometimes tension between libraries, which are primarily nonprofit, and commercial publishers. Is this an area where we can collaborate, where we don't have competing interests?
I think so, and I think it was interesting. I think when I was pondering that question of, are there competing interests, and the way that I see it is, we're a very mission-driven organization, and as far as we're concerned, our mission is to improve patient care. So it might seem strange to talk to a publisher and say, well, what brings you to work every day? It's actually, can I, through what I do, put the right information in the hands of physicians and nurses to get the best outcome for the patient? Your role is to get the best outcome for your patrons. They might be, physicians as well. If it's a hospital library, it might be medical researchers. So in my mind, I think we have very much the same mission to improve the quality of information that gets into the right hands of the right people. So I think there are lots of things we've done really well to collaborate together, and I think there are still lots of things that we could continue to do to collaborate for that core common goal.
Good, yes, I think so as well.
Good.
Are there any examples that you can, getting back to this collaboration, because it's really fascinating, and it looks to me like it could be an opportunity for both publishers and librarians. Getting back to this notion of collaboration, are there any specific things that Kluwer is doing, or even other publishers that you may have heard of that focus on this kind of collaboration?
I think it's finding tools that make our joint patrons, customers, whatever, users of the content, finding tools that help them to do their job better. It's interesting, it was something that James Neal mentioned in his plenary this morning. And for example, we have tools that will help a hospital librarian or a medical librarian do a systematic review. Store that systematic review. There are standards that need to be done, that need to be rerun every so often. So we have tools that help the librarian do that, and we get feedback on those tools, and we evolve them to help them to do what they need to do.
Have you heard of any examples of how that's worked? I mean, in a library where they've been able to do this kind of thing?
Oh, absolutely, yes. So with a systematic review, you need to obviously find the widest possible portfolio of content, and then set your criteria and rerun that. We've got some very nice examples of where people have run reviews. For example, there was I think it was a new strain of flu that came out a couple of years ago. One of our customers did a review of the deep literature and found exactly the same symptoms had been something like 25 years ago back in the literature, and they were able to surface this worked then, so maybe it would work again now. It was interesting that just very often in clinical research you think you need the latest, but actually sometimes patterns of disease can come and go. So that's an example of one for sure.